Hello, everybody. I'm very glad to be here today. Thanks, Olga, for the invite. I know you all or some of you, from the Paris Assembly meeting, which really blew me out when I visited and I became part of your group with my student. And I'm glad to see you here today. I'm back to my alma mater. I graduated a million years ago, my PhD from the electrical engineering department. Actually, yesterday and the day before, we had a reunion, all the students of my advisors, because on the occasion of his being awarded the National Medal of Science, Professor Kailath. So it's been a very nice 2 days. And it is like you come here, is it the water of the Bay Area? I mean, you start feeling very rejuvenated and very creative, and I also get into the spirit of creating and being inspired by you, and so what I'm here to talk to you about. I'm a professor at the National Technical University of Athens. I'm an electrical engineer, a computer scientist. In my group, we do work on cloud computing, Internet of Things, and data mining technologies. So, given the mixture of this group, I decided, the purpose of my talk is to get to know you better and try to communicate with you and maybe create the means of set collaborations forward for the future. So, the first part of my talk, I'm going to tell you some of the projects that we've done in biomedicine in collaboration with other partners, of course, where we've been ICT experts supporting with ICT technologies. And I'm going to talk to you briefly about two projects, the Ponte project and the Open Science Link project. So where we use some of our technologies in the application area that we're talking about. And then I'm going to spend a few minutes presenting to you one of the projects we're trying to start. And well, this is on the occasion of a call by the European Commission. This is often how the science and research scene operates in Europe, by collaborations and by funding through the European Commission, and see whether that would trigger any interest to any of you to form collaborations and maybe go as partners together. So what is the Ponte landscape? Stefan talked to you before about clinical trials. And of course, appreciate your vision of these clinical trials and opening them up to the to people and individuals contributing that from everywhere and voluntarily. This is a project that we did in collaboration with the University of Athens, and there are 6 clinics on cardiological diseases. And this is the landscape, like the starting point is, of course, this long cycle of developing compounds that can enter the market. So, of course, I have the feeling that a lot of people know much more about that than me, but I'm always impressed when I read my own view graph again, that says that it can take 10 to 15 years to get the compound out, and starting by 5,000 of them, it can only, through only 5 of them get through preclinical phase. And then it takes $1 billion for each drug candidate to reach the phase where it can enter the market. And this is a very cumbersome, a very expensive process. And 20 or 40% of the cost of this whole enterprise is accounted to clinical trial costs. So this costly process is mainly due to the cost of the clinical trials. Also, it's the case that 60 to 80% of the clinical trials failed to meet their deadlines because of the delay in the clinical trial process. So in the difficult to recruit patients that are fit the profile of the clinical trial. So in this landscape, we worked with doctors to be able to support clinical trials and to make them more efficient and to make them faster. So Ponte is a project that just finished 6 months ago, aims in providing a platform in facilitating the generation of hypotheses on how a substance can be used in the treatment of other diseases. Actually, our case that we tested in this environment was the reuse of T4 for cardiovascular diseases. So we designed the drug repositioning clinical trial and offer automatic pre-screening of potential study participants. So this is very small, and this is not supposed to test your eyesight, but this is to give you an idea of what our platform can do with the people that are trying to reposition the drugs into the treatment of some other disease. On the left-hand side is, so the whole idea here is to create a clinical trial protocol, okay, and make that in an efficient way. And try to use that, specify this clinical trial protocol in a way that it is able to define all the steps in the clinical trial and recruit patients in a semi-automatic way through collaborations with hospitals and organizations that have health medical care records that can be made available. So what we did is, with collaboration with our patients, we created a very detailed plan of what this clinical trial model is, which can be accessed in a linear way first, step after step, or it can be accessed through the whole thing is that you start with this interface. You're trying to fill out every single step in this clinical trial interface, and you can do that linearly, or you can go and work through the dependencies from one step of the clinical trial to the other one. So the browsing prompts you to the entries in the clinical trial that are dependent. And there are also some consistency checks that check that dependencies between clinical trial steps are met. And of course, there's another browsing probability, which is a semantic probability, which binds the clinical trial sent in semantic ways. That means relevant concepts such as the substance, the subjects, the target, and so on and so forth. So going to each one of these stages of filling out the clinical trial protocol, you have several tools that can be that you can use. One is a free text. It's hard for me to show here on the screen because I don't have I do have one.
Doesn't work on the screen.
Doesn't work. Okay. This works here? Yeah. So here we have an area where you can do free text research, search. So as you're filling out your clinical protocol, you can do free text searches. And this whole search is empowered and supported by our GoPonte search engine. I'm going to spend a slide on that later on. So apart from this preset free text engines, there are some proposed searches for the clinician or the researcher that can be used. Those are templates of queries that are filled by the parameters that the clinician or the researcher is filling in this clinical trial protocol. And there are also some customized queries that not only that are automatically generated, that take into consideration semantic links between the parameters of the clinical trial and other related concepts. So this is for the search part. So at each step, you need to do some search. There's a free text search. There's pre-computed searches for you or customized searches for you. And now for each one of these steps of the clinical trial protocol preparation, you have the preparation area, okay? So an environment, an authoring tool for you to prepare this step of the clinical trial. So an interesting part of that is the eligibility criteria for selecting your subjects, the people to participate in the trial. So we facilitate in that by trying to make a description of the characteristics of the population that make them eligible or not eligible for this for one type of trial or for another type of trial. But we also have a tool that automatically suggests criteria for inclusion or exclusion. So taking the parameters of the specific clinical trial, we're able to semantically link to what would be possible characteristics or relevant characteristics for this clinical trial or not. And finally, the final one of the, there are several capabilities, like there are more than 40 services for you to use in this environment. One important is there's a button that lets you estimate, given the inclusion and the exclusion criteria that you have, how many subjects you should expect for your experiment, okay? So we interoperate with medical records, and then in this environment, you're able to, for example, relax maybe the criteria that you've set so that you're able to include more people into your trials, or maybe, activate yourself and find links to other collaborators, other hospitals that would make patients available for you and link to their medical records through the interoperability tools that we have provided to make your eligibility, your set where you can select the subjects from richer. So this is, as I told you, this is the GoPonte search engine. Is a semantic search engine that uses the Yahoo API, but it is enabled semantically by the mesh ontology, the Go ontology, and the unit prototology. So those ontologies are used to prioritize what you see in your searches, in all the different types of searches that I presented, and also to annotate your results. And this is, kind of a presentation of what is the type of data that we're looking at as we're in this. So we have, of course, the web, but we have linked data. We have patient records in healthcare and other relevant databases. So the construction of this authoring environment has been dictated and has been done with, in collaboration with the clinicians. And it's been tested, as I told you before, in the thirst study. We call it the thirst study, which is the T4 hormone for cardiovascular diseases. And the result was quite satisfactory, and we're looking into using this for planning other trials. First, it was very easy to check the how many patients I can recruit, because it was just no effort, one button, checking whether the people are available or not available for participating in the trials. It looks like almost half of the criteria that the system suggested were actually incorporated by in the inclusion or exclusion criteria by the researchers and the clinicians. And the expressibility of this language, this language we have for expressing inclusion or exclusion criteria, has been able to express almost 85% of the criteria that the clinicians actually wanted to express, which has been good. So, Ponte, there's a reference in the slides when it is available, Olga, and people can test about it. So this is an area where we used our semantic technologies and database managing technologies and in order to support work in the myomedical work. Those are some of the results that, some of the publications that we have, and people can, can take a closer look into. So another area related to biomedicine, whether we've applied our results, is what we call the open science linked landscape. So this relates a lot to repositories of scientific and research data. And this is something that, you're very closely looking into it, I know. So we look into it not only for biomedical data, we look it for data and research. So, but we've done, in the framework of this project, we've done the experiments, we've used the Open Science platform to do proof of concepts for biomedical research. So in that sense, this project, I think it might be relevant to some of you. So the landscape is the following. It says that, as you realize and as we realize, not only for biomedical data, but for all scientific data, you have no universal, well-structured repositories that can work as benchmarking and experimentation and for comparison of scientific results. So there's also very poor linking of research with the data where this that has confirmed and has been used to conduct this research. And also there's been a lot of waste in replicating data and for the case of experimenting. Also, bad characterization, bad structure of scientific data, and bad misuse of them. Another area that we feel that needs improvement in this experimentation research with research data is the peer review process, that it is fragmented and lengthy. So we find that it's not easy to find the right reviewers, and it's not easy to verify the assessment of the reviewers for scientific research, and it's very difficult to empower these researchers, these reviewers, with the right tools to assess the work, okay? So there's a work that needs to be done, and ICT technology can really help you to empower this process, the review process. Also, specific to that is and relevant to that is the fact that the current evaluation methods for research are not able to reflect dynamics in research, characteristics that are relevant to specific research areas, and they're not really able to assess true novelty and true quality and impact. So one should be able to propose advanced evaluation metrics to assess the dynamics of certain researchers or the dynamics of core groups. And at the end, it is also very important to see also how this research actually address great challenges that society put forward. So in that sense, we're looking into parties that are interested to support research depending on how this research serves these great challenges. So is there any way to prioritize this research versus another research by evaluating how this research serves these great challenges? So this is the Open Science Link, is a platform that exploits the open access trend and resources in the scientific world, and uses social analytics and semantic web technologies to empower this whole process of conducting research and evaluating research and funding research. In this framework, this is an ongoing project. We have created new data journals based on what we call the Open Science Leak model, which is extensions of our current existing data models. We have created tools to semantically assisted peer review processes, like I described just now. Detect research trends, detect areas through mining through social networks or mining through the internet or mining in scientific publications. Detect trends, detect topics that are very, whereas the potential is great, because although in volume they've been limited, but maybe they are growing interest around them, and we should, funding or attention should be focused on them. And then, as I said, improve research evaluation services by creating scientific-aware, productivity, and impact-oriented criteria. So I'm going to skip the next two slides that elaborate more on this platform, because there's some references one can look into, because I want to go into the reason why I'm really here now is to establish collaborations with you in areas that might be of interest of both of us. So I'm going to describe to you a new project idea that we're looking into with some other European partners, and we're in the process of creating a consortium that will go after that. And I think it's very related to the goals of SAGE and the way you view the potential of participation of individuals into the enhancement of research in the biomedical work. So this says that there are policies that influence health, okay? And those are not only health policies. There are other policies that influence health, even more than the health policies, like policies that have to do with transportation, that have to do with labor, with urban planning, with insurance, with education. So the question here is, for example, can you be able to study or to create frameworks for create such policies, evaluate such policies, communicate such policies in a way that you can allow for prompt resource in case of, for example, infectious disease outbreaks, or provide robust and effective policy making in the case of non-communicative diseases. Okay, so in a picture, you have all the policies, like the health policy, the labor policy, the environmental, the framing, the nutrition, the insurance, that go into this platform and get out healthier, or not healthier, get out in a way, in a health-aware manner. And so, for example, and to do that, you use information from social networks, you use information from healthcare and patient data, you use information that you take from mobile applications and sensors, and you use existing knowledge base. So this would be, in a sense, extending the impact of what you have in mind for SAGE. Not use the SAGE bionetworks, the people, the data collected to improve your knowledge about the disease development. But use this data, use this big data infrastructure to be able to write policies and evaluate policies on their impact on people's health. So this is conceptual architecture, of course. So what is the big picture here is on the top you have a policy specification language. You have a language, an environment, a platform where you can write policies. And this includes policy formulation, policy review, policy modification, policy verification, and policy communication, okay? And then you have, in the middle, you have services that are able to implement this top layer, which would be policy simulation, spatiotemporal disease development forecast, public health risk assessment, and public health alerts. And below that is the big data technologies. Okay, so if you go from the bottom, you start with data quality management, data lifecycle management, security and privacy, confidence, a layer, basic layer of data treatment. And then you can, if you go up, you can say you need services or big data services related to social analytics, text analytics, spatial analytics, temporal analytics, and general. You go even further, then you go for pattern recognition, feature extraction, prediction, knowledge discovery, and so on and so forth. So we say that on top you have the policy-related language and services, and on the bottom you have services to treat the data, okay? So if, and this of course is empowered, and it's only gonna work if you have data associated with it. Like, you know, healthcare data, as I said, social networks data, and so on and so forth. So, for example, what are the type of pilots that you can build with that? One is, for example, there is related to the increasing number of immigrants that Europe is experiencing right now. There's 2,000 immigrants waiting to immigrate from Syria to Europe. Leave aside the ones that have already immigrated. I mean, it's a problem in Greece that, you know, is going through, and it is really made even more difficult because of the economic crisis, right? So health issues related to immigration and how policies, immigration policies, transportation policies relate to that. Or one can see into more long-term public health-driven policies, like, for example, the development of cardiovascular diseases or cancer because of policies. And this is, of course, to take into relate the special characteristics of special populations, like, you know, genes that are more common in Greece than in France. And of course, you know, I can go on and on with that. So we see two types, or even more short term, that says that because the temperature is such, because the day is such, and there's low CO2 in the atmosphere, then what is a policy, a short-term policy, for example, a traffic rearrangement, okay, like an urban planning rearrangement that can tackle the risk of the health risk, okay? So we look, what is the potential collaboration here? It's, I mean, we say that why don't you make this data available for purposes beyond discovery of on the specifics of the disease? If this data that you collect is provided as part of this platform, or, I mean, maybe you might be willing to even improve the annotation of this data in order to be able to use it in this context, or even create new study research kits that relate to that, okay? So we built another research kit that relates to policies now for specific diseases, not only to monitoring data to make available to everybody to study more profoundly and more deeper the development of a disease, okay? And, you know, I saw that you have those dream challengers forward to motivate people to come forward and make a hypothesis or make new models. But now maybe it would be a good idea to create a dream challenge for researchers to compete in the offering of public sector policy models, not policies no models for cancer now, but public sector policy models. So with the hope that this will interest you guys, thank you for your time. I hope I didn't take more than I should. Okay, thank you very much.